Good evening. Welcome to Islantis seminar on modern identity strategies for today's healthcare IT realities. I now take pleasure in introducing our founder CEO, Binod Singh, Islantis Technologies, to take this forward.
Thank you, Khushbu. In the interest of some more people joining, I would appreciate if we can wait for another 2 minutes exactly, and we will begin at 2 minutes past 4. Thank you. Well, this is Binod Singh again here. Welcome to the webinar on the topic for today is modern identity strategies for today's healthcare IT realities. This webinar is essentially going to be dwelling in depth on how Narayana Health has gone ahead and not only formulated but very successfully executed the identity management implementation and running it on a day-to-day basis in their organization. I take pleasure at this moment to introduce Mr. Kumar, who is the Group Head Information Technology for Narayana Health. Mr. Kumar has been in the IT industry for a long time, and very interestingly, he has worked on the other side of the table. He has been one of the important members of PricewaterhouseCoopers in India. In his last assignment, he was heavily involved with the cloud computing part of it. He's also been, during his career, very heavily involved with areas such as strategic enterprise architecture and IT strategy and transformation, which is very, very important in the changing grounds of IT reality of today. With that, I would request Mr. Kumar to go ahead and do his presentation on how he implemented the identity management strategies in Narayana Health so successfully. Mr. Kumar.
Mr. Vinod, and good evening, ladies and gentlemen. And I really appreciate everyone to take time off their busy schedule to join this webinar, where we are going to speak something which is very important, from an information security perspective, from an organization standpoint, and from a business standpoint too. So, as we know, healthcare providers, are the front line, for when it comes to the when it comes to providing health services, healthcare providers form the front line because the first contact which is made by a patient is basically with a healthcare provider. And once the patient basically enters the premises, he or she undergoes they come to us for solving us a lot of problems. And when they actually come in, they go through a series of process, right? Starting from registration to billing, to seeing a doctor, and undergoing a lot of tests. What is very important in this entire chain is there is a lot of data that is actually being collected, and most of the data that is actually being collected is sensitive personal information and personal identifiable information and personal health information that is actually collected, right? At various stages. When you come to a registration counter, you are asked about the demographic details. It is about billing. There is payment. There is card information that is actually there. When you meet the doctor, it is going to be about your illness information, the medication that you are actually taking, and other related, your previous symptom history or previous medical history, and several other details. And when you go for tests, then whether be it a CT scan or an MRI or an ECG or an ultrasound, you go through several kinds of you go through several kinds of imaging technologies from a test standpoint. And across all these various business process, what is one thing that we actually see is an exchange of data, but also importantly, there are several stakeholders from a healthcare provider standpoint, who manages this, who enters this data, manages this data, modifies this data, views the data. Then this is exactly where identity management fits in, because these stakeholders who are actually responsible to who are responsible to insert, modify, update, delete, or do any action with the patient's data, needs to have appropriate roles and privileges, and they also need to be authorized, to access the hospital information system or the allied systems which also talk to the hospital information system. So identity management in healthcare plays a tremendous role in ensuring that there are only authorized users are basically authenticated into the appropriate systems. And if we go by the previous statistics, and based on the research or a survey that has been conducted by Synergistech, which published the Breach Report 2016 of Protected Health Information, what is very important to note is around 40% of healthcare data breaches involves unauthorized access, right? Because all these data is very valuable for hackers. So any given chance, even if there is a small opening in the system in terms of in terms of a vulnerability or through a port number, they are able to access, and which in turn creates a breach, and they are able to access all the healthcare data. So, with all the growing threat scenario landscape, with multiple vulnerabilities to malwares and ransomware and other phishing attacks that are actually there, identity management is very important from a healthcare provider standpoint. Now, what I would speak today is what we have actually done. There is no gyan that I'm actually going on identity management, but I'm going to speak something very relevant of what we have actually done, and how we have actually gone and implemented identity management. What are some of the major challenges that we faced? How did we implement the identity management solution? What were the major portions of it? How identity and access management has actually helped, and what are my future plans? Okay. So let me first go through what were my challenges. Okay. So when I talk about challenges, I've summed up only the key challenges that are actually there. So we have a very small application landscape. NH has around 50 healthcare facilities. We have close to 16,000 associates, and they are segregated into nurses and paramedics, doctors, administrative staff. Okay, and these are nurses, paramedics, doctors, and administrative staff from the 4 broad groups in which associates are actually classified. Okay, and each of them performs clinical operations and non-clinical operations. And based on our, based on number of facilities that we are spread across the length and breadth of India. And all our applications, business applications as well as system applications, are completely hosted on a cloud-based infrastructure. Okay. When we started out with this project, we never had a centralized authentication repository. Okay. Each application was its own identity, had its own identity database, which means that for all the business applications that we had, like hospital information system, the ERP system, the human resource system, the compliance management system, the health system, and the various systems that we had, every one of them had their identity database. So one user had to deal with many identities, and he or she had many identities, which makes which in turn had many passwords. So it was cumbersome, from a end user standpoint. But let us see this side of it. If there is one identity, or if there are many identities across many systems, then from an IT standpoint or from an information security standpoint, audit of identities becomes a very tedious, time-consuming, and an error-prone activity, because I would now have to reconcile close to 16,000 IDs on a on a month-on-month basis, which means that every month we do user access reviews, and every quarter we do role privilege reviews. Okay, and we have to get confirmation from the head of the department. So audit of identities, and by the time you finish the first audit, the second audit starts. Okay, so audit of identities was a huge challenge. The third problem, as everybody knows, is multiple passwords for multiple applications. So this was a major, this had a major impact on customer satisfaction. Okay, because everybody kept complaining that why should we have multiple passwords? Why can't we have single ID, single password? And that was actually the one of the asks from every one of the users. The fourth challenge we had was password resets. I know password resets are some of the most frequent help desk calls that any organization would actually get, and we are no different. And we are dealing with close to 8,000 plus nurses and paramedics are actually there, which means that when password resets are something which are very regular, and people and nurses and paramedics or even doctors, they do a lot of clinical work, they're bound to forget their passwords. So password resets to the unit IT team was so enormous, and that used to form the bulk of the tickets. Okay, and it had to be performed separately on each application, which is even more tedious. Okay, so what at some point in time, then there was, people had, when the administrator basically sets, then there is a tendency that to set a weak password and basically give it, or even there is a tendency from the end user perspective to keep easy passwords. And the last one is whenever an associate onboards or offboards, right, the provisioning and the deprovisioning of identities across multiple applications was a huge challenge. We have to ensure that, especially during a clearance process, deprovisioning has to be done in a very clean manner, and in all the more because taking into account the access he or she would have actually had based on the level and designation. It is very important that those identities need to be taken off. Okay, so these are some of the major challenges that were actually there. Okay, now we go to the next slide. Okay, so now how did we basically go about implementing identity and access management? As we all know, in order to implement any identity and access management solution, the first and foremost thing that we need to have is an LDAP service. And the LDAP service, what we implemented was the Active Directory services from Microsoft. Okay, we hosted the entire Active Directory services on the cloud infrastructure, right? And once we also ensure that it is designed appropriately, it is sized appropriately to cater to the load that is actually there. Once we implemented the Active Directory service, we then identified now which are all the system applications amenable to get configured to the Active Directory service. So we identified those applications which can actually be configured to the Active Directory services. We configured that and ensured that we promoted all those machines to the domain and configured that. And now we implemented the single sign-on solution from Island Test. So in the single sign-on solution, we ensured that so single sign-on was very important or very core to the success of the entire identity management solution, because every day a user, would basically come to the single sign-on dashboard and access the business or the relevant system application. So it is very important that the single sign-on application had to be sized appropriately and also designed appropriately also, so that look and feel as well as the capacity planning is done appropriately. So we deployed the single sign-on solution from Island Test on a pair of servers, put a load balancer and got that load balance. And we also ensured that the applications which are connected to Active Directory, because it is in any project, it is very important for us to show quick wins to the management also. So what we did was, for those applications which are actually connected to the Active Directory, we basically publish those applications, and there are various different ways in which an application can be integrated to single sign-on. So that was actually done, and I think the presentation went off. No problem. Oh, okay. So that was actually done, and we ensured that the other key thing is, once this is all done, it is very important to communicate properly to the end user. Okay, so we can implement a great solution, but if we fail to communicate, which is typically what we call as change management, then the adoption won't happen. So we ensured that people use the single sign-on solution. We bookmark the single sign-on web page in each of the browsers, each of the end user desktops or laptops browser. We got posters out, and we have close to 6,000 to 7,000 people now logging onto the single sign-on solution. And that's truly amazing. The adoption has been phenomenal, and people are able to seamlessly access. For those applications which we had to buy third-party components or their own native components to integrate with Active Directory, we came up with a different solution as how to manage the identities. At the same time, also do password synchronization, because we still wanted to ensure that we get onto a single ID, single password regime. Okay. Now, once we implemented single sign-on and perfected the process, and after we resolved the issues, because any new system is bound to have issues. So we had our challenges or our technical issues which we got fixed quickly. Now, the next part was to implement the most critical part, and by far many organizations would basically can easily get lost in this identity provisioning exercise. Okay, when we talk about let us say the provisioning management, which is called as XA, we have to first see from where are we going to get this data. What is the source of truth that we are actually going to refer? The source of truth in any organization should be the human resource management system. Okay. So we integrated the XA provisioning system to the human resource management system. That is the first part. Entire logic, the business logic, how IDs are basically created, how email IDs should be assigned, what is the onboarding and offboarding. So all the logics were actually documented, and then we configured the XA provisioning to the XA provisioning system to look up the source of truth, which is SAP HRMS. Then what we also did was we connected the XA provisioning system to the Active Directory system, because Now, SAP HRMS pumps data into a staging table. XA picks up that information, understands the information what has been pumped in. It knows what logic it is, and then it goes and provisions the account in Active Directory. And what we also did was, since we use Office 365, we ensured that we use something called as AD Connect to connect our Active Directory to Office 365. So the moment an ID gets provisioned in Active Directory, an account in Office 365 gets automatically provisioned, and the password that is used for Active Directory is the password that you use for Office 365. Okay, and by this, what we also did was, those applications already integrated with Active Directory. We were able to seamlessly log in. We created groups and assigned the appropriate roles and privileges and ensured that we were able to log in. Okay. So for each application, if we want to integrate, we have to ensure that there were appropriate requirements. So, requirements is something which many of us don't provide clearly. It is very important that we provide requirements very clearly, and also ensure that the functional requirements are converted to, into the right technical requirements, and it is implemented in the appropriate. And post that, we also have to remember that we have to do proper user acceptance testing to ensure that all use cases are basically covered, to ensure, which in turn will pave the way to go live with the solution. Okay, so this is in short as how we implemented the identity and access management solution, for NH. And so let me talk some of the benefits that are actually there, right? So the first benefit is easy access to applications. So when I log on to my single sign-on dashboard, I see all the icons lined out very clearly, so I exactly know what to click, and everything gets launched and authenticated in a single click. Okay, saves a lot of time. I don't have to remember any multiple passwords. Okay, so that is part one. That is the first benefit. The second benefit is simplified identity governance. Now, we have all this going on. Now, how do we govern the system? How do we monitor the system? How do we manage the system? Very, very important. So, when we talk about governance, we talk about reporting, we talk about what has been created in the last 1 day, last 3 days, last 5 days, how many IDs has been re-provisioned, has all IDs which has been marked as withdrawn or released or resigned in the HRMS system been deprovisioned in in the Active Directory also. Okay, who has requested for detailed role privilege access, who has approved it, what are the number of approvals, various facets basically come into identity governance. Okay, so it is very important to simplify identity governance, because that will really help during audit period. Then overall improved user experience. So from remembering 6 to 7 passwords, we were able to bring it to 1 to 2 passwords. Why 2 passwords is because our HIS system still has to be integrated to LDAP, but we have found a different way to get that signed on also. So improved user experience, reduce help desk costs, because if you are able to get lesser number of tickets, we are able to reduce the cost. We are able to take away we are able to reduce the number of engineers in the unit level also. Increase user productivity, so user need not go to resetting passwords and having role privilege issues and password issues. So that time saving will actually help to boost the user productivity and increase business agility. So if you are able to get things up and running much faster and get integrated much faster, to the identity management system, the agility is definitely pretty high. Okay, so these are some of the benefits from identity and access. These are some of the benefits that we got from the Identity single sign-on and XA provisioning system that is actually there. Now, what's the future, right? So we implemented only the basic version of the identity governance. So one is to implement the complete identity governance module. That is one. Second, now that we have given single password to everyone, every doctor and to nurse and everybody, now they're saying that okay, you get a single password, now give us a better way to log in. So OTP based login for doctors is something which we would work on. There are some areas where the nurse or the paramedic or the doctor will not be able to type. So in that case, can I do an RFID based authentication, right? So that is something which we are exploring. Apart from that, when we talk about other mobile applications, how to do mobile app based identity and access management, that is one. And then identity analytics, how do we, build a dashboard which basically shows various facets of, who logged when, how many requests basically came in. These are currently available in reports fashion, but once we get the overall identity analytics picture, and we can always start with that, and then there can be multiple drill downs that will be there, which would basically improve the way in which we see things from an identity and access management standpoint. So these are some of the future plans that we have in implementing this. These are some of the future plans that we have, in mind, and we are working on that. Great. So I'm open for any questions, and I can tell you what we have actually done. So please go. Thank you so much.
So thank you so much, Kumar. This is Vinod Singh here again. Before I go and tell the participants of the webinar a little about Islantis, there are a lot of questions that have come in the chat mode, and I would like to read out some of those. Some of those questions are for Mr. Kumar. In fact, I will direct all of them to Mr. Kumar, and then some of it which may have to do something with Islantis, I could pitch in as well. So Kumar, the first question that is there is SSO able to perform on customized application or software developed by your organization?
Yes. So we are, the SSO is able to, as long as your customized application speaks to LDAP, SSO can again speak to LDAP also. So, and authenticate. That should not be a problem. But whichever is the homegrown application, you have to ensure that it is LDAP compatible. Or there are other ways to do it, through the SSO solution also.
So just to add to what Mr. Kumar said, Islantis single sign-on as a software is designed to do single sign-on to any application, and be it a thick client application or an application which has been internally developed and highly customizable, customized kind of a web application. All the different kinds of applications can be used for single sign-on. Mr. Kumar, the second question is, what kind of resistance you faced in people adopting to the single sign-on solution? And there's a second part to the question, how did you overcome the resistance?
See, I think people were very frustrated, to have multiple passwords. They had 5 passwords, 5 different IDs. So there was no resistance, but people really appreciated that we got in a single sign-on solution. Okay, and we said that now you have to remember only one password, and then you'll be able to access the application. So that was the biggest thing. So actually there was no resistance, but then from a change management standpoint, when we talk about adoption, we have to get the message out, right? So nurses and paramedics, the attrition is also pretty high. So new people keep coming in. So what we did was we printed out appropriate posters, and at the time of joining and at the time of induction, we are able to communicate about what the single sign-on solution is, how they need to log in. We show them demos. Apart from that, every 15 days, the unit IT basically goes around to each and every user and say, do you have problems in logging to SSO? How are things performing in SSO? Are you able to launch all applications? Is there any else that you want us to do? So through those methods, we were able to come. So it's again a little more personalized service at the hospital level. Not everything can be, driven, from a central standpoint. I can send 100 different posters, but the end user has to really see the posters. Nurses and paramedics and doctors don't have the time to see those posters. So one-to-one service at the unit level, the engineer goes to them, have a casual chat, and basically tells them, shows them how things work. That has actually improved the overall adoption.
Thank you, Mr. Kumar. One more question. There are two parts of the question. First is that was it easy for you to get funding for the project? And the second part of the question is, what has been the reaction of management to the implementation?
Okay, so first thing is, I know funding is a major challenge. In NH, the governance process is very clearly set. Okay, first the solution has to be affordable. Okay, and if there is a premium that needs to be given to the solution, this is something which we definitely look at. And before subscribing to any solution, there has to be a very strong business case. We prepared a very strong business case, which basically reflected the ground state or the problems that people were actually experiencing. Okay, so when you compare the problems and the cost of the solution, the management said that we do understand the problems and they approved the funding. So any project, if it has a real business case and if it basically solves a challenge which is experienced by the ground force that is actually there in your hospital, will definitely get it. And that's how our budget got passed.
Thank you. I will put one more question, after which there are a couple of questions that appear to be more directed to Islantis. So I will bring in my presentation for just about 6-7 minutes in between, and then we will, Mr. Kumar, go back to rest of the questions. But I'll put one more question to you from one of the participants in the webinar. While selecting a solution, did you look at the traditional technologies such as IBM, Oracle, and CA?
Okay. I think in all due respect to IBM, Oracle, and CA, let me put it this way. I have all respect for all the providers which Mr. Vinod had actually mentioned. But NH's vision is to provide quality care at affordable prices. Okay. So I will underline the word affordability. And Islantis solution, the solution which Islantis proposed was definitely affordable, much affordable than any other provider, right? So we evaluated all the solutions, we understood the pros and cons, and then made a very informed call of choosing Islantis single sign-on and identity provisioning solution.
Thank you.
Okay.
Before I go to my part of the presentation, I'm getting tempted there are a lot of questions that are coming in. So one more question, and this is a simpler one. This is on the technology. Need to confirm whether the solution works on different versions of Windows, and there are certain versions that are mentioned here. So the answer is yes. And the Islantis solution works on all the different versions of Windows that we see here. With that, Mr. Kumar, please stay on. Since some of the questions that are coming have more to do with technology, I would and Islantis. There are a couple of questions on Islantis also. So I will do a few slides, spend about 6-7 minutes, and then we will once again go back to the questions. Meanwhile, to the webinar participants, once again, I request you can send more questions. We already have about 3 or 4 questions which are pending, but we can, given the time, I think we will be in a position to take a few more questions. So very quickly, for those of you who do not have been exposed to Islantis, we have been a company driven by innovation in the area of identity and access management. We have been one of the first companies in the identity and access management globally, beginning to provide third-party services on traditional technologies of identity management. We learned the domain and went on to develop our own suite of products about 6 years ago. The new space that is opening up in identity management is called Identity as a Service. And the next version for us, which is quite a breakthrough on Identity as a Service in the industry, would be out sometime in July, August. We have been highly rated by the analysts and the user communities as well. Talking about the analysts, this just verbatim puts some of the comments that Gartner has on Atlantis. And in particular, I would talk about the first point, because the technology, according to us, is only as good as how it serves the customers. The customer references that are available, especially in the US, because in India, things have just about started moving, and pioneers like Mr. Kumar and Narayana Health are coming up to implement the technology. Similar is the case in other industry segments. But in US, as you know, this technology is quite mature, and fairly large number of organizations have already embraced it. So there is a fairly high customer reference that are available for this product globally, in particular in US, and now very much in India as well. This gives a very quick idea of some of our customers in India. Frankly, we have been very overwhelmed to see the kind of response we got in India as we came in here truly to sell solutions in larger numbers about 2 years ago, even though some customers like Narayana Health have been with us for a longer period. So we have customers in practically all the key segments. I will address a question here. There was a question in terms of the kind of customers that we have in the healthcare segment. So when it comes to India, from the hospitals, care segment, we have only Narayana Health at this point, and we believe this is one of the very first implementations of identity management in the industry, though we have got a lot of interest coming in from many other hospitals now. Worldwide, more in the US, we have Blue Cross Blue Shield of Illinois, Blue Cross Blue Shield of Texas. We have Cigna, we have Medtronic, we have TMG Health, Presbyterian, and also the American Health Medical Association uses our solution, which is not truly a hospital, but then they're using our solution is a great thing towards, again, our referenceability. So this particular slide gives a few of our larger customers in the space in the US. Essentially, identity management solution of Atlantis, which is now rebranded as IDaaS, Identity as a Service, is modular. It has a single sign-on with password management. That is one module. The Lifecycle Management module essentially takes care of provisioning new employees into the organization to their applications, and also helps in terms of when they have additional requests for additional accesses. It takes care of all that. It does support things such as role-based lifecycle management and so on. And then, of late, we have been working a lot more on the access governance side, where questions such as who has access to what is he doing with the access, does he still need the access as per the role or the position that he is in, who authorized his access, things like those are done through this module. Another area which is of great importance we have seen to hospitals and similar organizations is on orphan account management. A lot of complaints, a lot of audit issues coming up in terms of people have left, but their IDs are still there in one system or the other. These are taken care of by the system. One of the first things people implement on the access governance side is an access review system. So an access review is generally performed manually by most of the organizations. Let us say you've got 10,000 important users, and they have access to certain applications and certain entitlements within the applications. But you would like to give a chance to the manager or to the application owner on predefined intervals. It could be quarterly, 6 monthly, annual, to once again recertify the accesses that they have. And at that point, they have a choice while doing the review to say this particular access for this particular employee of theirs can still be kept or can be revoked. In case it is a revoke, the identity management system automatically would take care of the revocation and do the reconciliation for proper governance. So those are the kind of things that are done in the access governance system. Importantly enough, there are many other technologies that are becoming a part of identity management, and in our next release, which is going to happen from July right through up to September end, there is going to be the mobile device management that would become a part of our solution. Very shortly, we are going to have the privilege access management, which takes care of the privileges that are given to the administrator for very high sensitivity access would become a part of the identity management system. And the authentication is going to become, there are some additional modules like risk-based authentication is becoming very important to many organizations. All those things will be there. Besides many other ways to authenticate, like through iris scan or behavioral or biometric and so on and so forth. This is how the single sign-on solution works. I'm not going to spend time here. All I want to say is that this particular solution of ours has received already 2 patents. In fact, the second patent we got granted from the US authorities only last week, and that by itself shows the kind of uniqueness we have in this solution. I'm not getting into the features. We can send these sheets to many of you. If you need, we can send you more product details later. The password management essentially does 2 functions. It takes care of the self-service password reset. So when people have to reset on the expiry of the password, they do that. This also enables them to have one single password synchronized to all the applications that they have. And also when you have forgotten your password, it helps you to reset. We did talk about the lifecycle management. So again, I'm not going to spend time here. Next. And the governance, I have already given you a quick introduction to. So I'm going to go back to the questions. There is another question that has just popped up, which is it possible to detect instances of improper or suspicious credential usage and use those detections to trigger additional controls? So an excellent question. The answer is yes, identity management technology is now beginning more and more geared to do this. So this is done in 2 different ways. It is it is done through high levels of authentication. First of all, risk-based authentication is a behavioral authentication that is going to become a part of our offering very shortly, is one of them. So typically, let us say somebody has been, as a regular behavior, he has been logging in from his desktop, let us say between 10 and 2 p.m., 10 a.m. and 2 p.m. And suddenly the system finds that the person is logging in from his mobile phone, and that too not from within the network. The system detects that, and based on that, it immediately will upgrade, or it will introduce a second factor of authentication, which could be an OTP, it could be a biometric, whatever you have decided as a policy, it will do that. The same situation could also be that the person who was logging in from Bangalore all this while suddenly now is logging in from, let us say, Europe, somewhere in Europe. Once again, the same thing. The authentication would automatically be increased to the next level. The system would be able to even stop the access if you say that you will not accept, for example, an access from Russia or China. Then the moment there is a login that is coming from there, the system would not enable you, even with an additional authentication, to go forward. But the best part would be that once somebody has successfully authenticated on the second factor from, let us say, another location, the next time when he logs in from there, in all probability, the system would not challenge him to the second factor, because now it realizes that his behavior includes logging in from such and such or a second location. So that is one way of doing it, which is through the risk-based authentication, which we will have shortly. The second one is through the identity management system also, there are certain ways in which we can look at the suspicious behavior. This can be from within the system, or it can be by connecting it to applications such as the security incident and event management, or what is called SIEM. So we have ready hooks to SIEM systems, and that could help you in doing that. With that answer, I'm going to pose the next question to Mr. Kumar, which has come from another participant. This is a very broad-based question, Mr. Kumar. It says, what will be your message on identity management to the healthcare industry based on your experience?
Okay. So, as I said before, from a healthcare provider standpoint, we deal with a lot of data, which is sensitive personal information, personal identifiable information, and personal healthcare information. And it is very important that their appropriate safeguards are actually put in at various stages to ensure that the data is actually protected. One of the primary protection that we need to do, that we need to enforce, from a system standpoint, is from an identity and access management standpoint. So whether whether to ensure, or the first thing is to ensure that the person who is actually logging in to that particular application is the authorized user, and let us say if he or she is authorized user, then has the appropriate role and privilege been assigned. And it's very important to understand this basically depends which module he or she gets access to, right? And and the information that gets exposed. So the message to all healthcare providers is this is something which is inevitable. It needs, if implemented in the right way, it will help. The benefits are tremendous. And I think providers should not treat this as a one-off solution, as something which can be done through other other native techniques that are actually there. But if they see, and this is not just to reduce the number of passwords or to reduce the number of calls to help desk, but it is also it is something more than doing the single sign-on. The single sign-on is the first step, but then getting the identity provisioning, role privilege, auditing, and periodic monitoring. Those all basically define an identity and access management solution. So providers should see the larger picture and think it from that perspective, and then take measured and structured steps to consume an identity and access management solution.
Thank you. There's one more question. There are a lot of questions coming up. This question is, in my last role, in my CIO's role in the last organization, I tried to implement an identity management solution. It took me 2.5 years, but I could not do much. So the question is, how did you achieve success in this particular area? Because in general, I'm not able, it says, in general, I have a lot of complaints. I hear a lot of complaints of it not being successfully getting implemented.
So what I would say is, one, we also, when we started the solution, we never had an Active Directory. So there were a lot of challenges on our side to get the project up and running, right? So it is very important, and there has to be a very strong will to get this project successful. Okay, and if you have written the business case and got the budget approved, then it is in all more interest that to get the solution implemented right way. So we also had our initial challenges to get the Active Directory up and running. Things were new. People were basically very new to the solution, and it took more than what we anticipated. Also, to be very frank, in getting the solution up and running. So there are challenges that we also face to get things done. But that said, we made it, and that is because of that is the support that has been provided by the executive management and the steering committee to get this solution implemented. So the directive was from the top, and the directive was very clear that yes, we have taken this solution, we need to implement it, and when the directive basically comes from that level, things would definitely get improved. So you need to have a very strong sponsor, and in this case, our sponsor was our CEO and CFO, and the chief of medical services also. So it was pretty easy for us to get this thing through, I would say.
Thanks. Another question, Mr. Kumar.
Yeah.
We have recently acquired a number of smaller hospitals in other locations. These do not follow the same applications as ours. Would your single sign-on solution be able to address that?
Okay. So I can answer that, but the question more seems to be to Islantis, Mr. Vinod, or you want me to answer that?
Why I'm turning it to you, I will also add to what you will say, because I know you have done also similar, you have some similar experiences that once you talked about.
Right. I think our model is basically whenever we take up operations of a particular hospital, then we implement our technology solution, which means that whatever existing applications that they have will eventually get migrated to our application. That is what we have actually done. So there is not much of systems that I had to connect. I never had to connect anything from my SSO system to any other system and get that thing published. But that said, if you are acquiring, if you have acquired multiple hospitals and there are multiple applications in each of the hospitals, then you can anyway integrate with Active Directory. SSO can speak with multiple Active Directories. So Mr. Vinod will be able to explain that, and provide a single pane through which all applications can be accessed. Mr. Vinod.
Thanks, Kumar. So as Mr. Kumar said, it is very the solution, the software supports multi-forests and multi-domains in the Active Directory. So that is one level, and therefore, even though you may have a central management, multiple hospitals with different technology sets or different Active Directories can be supported. In fact, there's a related question over here, which is that if I do not have AD for all my employees, can I still use the solution? So the answer is yes. And this is a scenario which we are seeing building a lot of late, because AD has become, the CAL licenses and all that have become quite expensive. So there are multiple requests that we had from many of our customers to support directories such as OpenLDAP, which does not cost any money and is almost as good. So we out of the box support other directories also, which includes OpenLDAP. The other part is that in the new version of our product, which will be, as I said, in July, from July onwards, we start unveiling that product. We would be providing a directory from within the system itself. So there will be an Islantis directory. It is a free directory, and that it will enable you, that would take away the need for you to implement any other directory. So as a part of the identity management system itself, you'll have a directory if you're not wanting to use AD or anything else for that matter. Well, one more question. Need to check any inbuilt log management or reporting system so that customer can monitor the same, if no third-party compatible tool which can integrate. So the identity management system is not exactly a log management system for outside the identities. Anything that is happening with the identities, this system can keep a log. It has got good reporting, and very soon we are going to have specific analytics also, because there's an analytics engine that we are building now, which would make it easier for you to manipulate the data regarding identities in every possible way. But if by monitoring you mean here specific incidents and events happening anywhere in the system, that is not a part of the core identity management system. Any third-party tool that you use could support it. We can talk offline on this, but there are third-party tools which are which are available from open source, and they are very good ones. Even those, any of those solutions do integrate with Atlantis identity management system. I have already got a few questions, but I'm just, I can see some more questions coming in. We don't have a lot of time. We would like to have the session end in the next 5 minutes. So I'm just doing a selection of some of the questions, and let me take one or two out of those. Well, this question is I think more directed to Atlantis. Is Atlantis solution modular? How long does it take to implement? It's a very interesting question, because identity management, there's been a lot of disillusionment around it in the past, because most of the systems that have been available could not get implemented in a short time. Besides being very complex and time consuming, the cost was another factor. The new generation of identity management systems that is coming from smaller organizations like Atlantis are not based on the traditional technology. So, like for example, the new version that we are bringing out is essentially capturing 95% of the functionality needed by almost 95% plus organizations, corporate organizations. 5% would still not get addressed, but the positive aspect of that would be that the time to implement is going to be, as it is right now, it's less, but it will become almost 1/10 of the traditional technologies. And the total cost of the solution, including support and everything, would be in the range of anywhere from 1/5 to 1/10 of the conventional solutions, cost of ownership. So, be assured, you are going to, like any other technology, you're going to see here also some of these things happening. We are the only vendors from Asia Pacific with its global support center based out of India to support our India customers better than anyone else. You will have, if you have more interest in the technology, I would only request you to send us a mail, and we would share with you some of the very interesting developments that are happening. I think we have just about time to take one more question. This question is to you, Mr. Kumar, and I think you have in some senses answered this question as an answer to one of the previous questions, but all the said, I will put it here. Why did you choose Atlantis technology, and was the support and implementation also provided by Atlantis or its partners?
Okay, so as I told before, we have we have respect for all the service providers from who provide the identity access management solution. We did a thorough evaluation of the open source as well as the proprietary products that are actually available from multiple from these solution providers. We understood, we mapped our requirements to it, we scored it, we identified what the pros and cons of each solution from a technical aspect, from a functional aspect, as well as from a commercial aspect, and then we took a call of aligning with Atlantis. Okay. To answer to the second question, yes, Atlantis provided the support and the implementation part. So it is all one big project. So not only to provide us the license, but also provide the initial implementation as well as the day-to-day operation support for the product.
Thank you. Well, we seem to be at the top of the hour. Mr. Kumar, I thank you on behalf of Atlantis and all the participants in this webinar for an excellent presentation. Certainly, I gained quite a few additional things that I did not know about your industry and how this solution has helped your organization and some of your plans. I have some additional questions that are here. Many of them are to Atlantis, and I would offline we would reply to them in mail and otherwise. Once again, Mr. Kumar, thank you so much for a very, very enlightened presentation and answers.
Thanks, Mr. Vinod. I really appreciate everyone for coming on to the webinar, and I appreciate the opportunity. Thank you so much.
Thank you. Bye-bye.
Bye. Bye-bye. Thank you.